I'm presenting on Ileo-Rectal Anastomosis using a new magnetic device in a swine model over 6 weeks. These are my disclosures. So, a fair complication of rectal cancer resection is an anastomotic leak causing significant morbidity. And the incidence of this leak may be up to 20% despite improvements in surgical technique and perioperative care. We've had previous human experience in duodenal-ileostomy, magnetic, and gastroileostomy, which have shown a nice patent anastomosis without any leaks. So the aim of the study was to look at the feasibility of a magnetic ileo-rectal anastomosis. We've used an anastomosis between the last 15-20 centimeter of ileum in the pig and the upper rectum, side to side, using 50 to 60 kilo domestic farm pigs with a lower midline incision and a proximal ileostomy to bring down the proximal magnet and perianus delivery of the rectal magnet. We did fluoroscopy after on day 0 and every week until 6 weeks, where we did a necropsy and looking at the macroscopy and histology of the anastomosis. We use linear magnets of 14 by 53 millimeter, and you can see in the picture there between the ileum and the rectum and the bladder that is distended. This is the image that we get on the ileo upper rectum at the iliac crest. If you do a side view, you see that the compression early on is not present. And if you look at 7 days, you can see the two magnets almost touching each other, but not yet. And at 2 weeks, and here 3 weeks. At autopsy, you can see macroscopically the anastomosis between the rectum and the ileum. There's very little outside fibrosis compared to our ileostomy site, where we have quite an amount of scar tissue on the surface. This is the excised specimen. The open specimen, very smooth, no ulceration, no inflammation visible. And this is the other animal. Here you see quite a distance between the rectum and the ileum on the side view. At 7 days, this specific animal, the anastomosis is extremely beautiful between the ileum and the rectum. This is the ileotomy site with the scar tissue, the excised specimen, and again the open specimen where you can measure the anastomosis. The other animal at day 0, side view. And I want to show you this because it's extremely repetitive and extremely reproducible. And we get here the ileotomy scarring, the anastomosis between the ileum and rectum, excised specimen, where we examine the diameter, and the open specimen, again, no ulceration. And in this other animal, the distance between the two magnets initially at day 7, day 14, and day 21 until it is out of the anastomotic site. Again, this anastomosis, nice and beautiful, excised specimen, and open specimen. If we look at the anastomotic device dislodgement study day, you can see it dislodged at day 10, 10, 17, and 14, the average being 2 weeks. And if you look at the anastomosis lumen diameter, it's 30, 38, 28, 34 millimeter, and the complete circumference go from 48 to 83 millimeter. If we look at histology results, you can see that between the anastomosis and the ileotomy, we look at the incidence of serosal fibrosis, mucosal fibrosis, serosal vascularization, or mucosal stricture at the region of the anastomosis, and you will see that Serosal fibrosis was present in the ileotomy in all the animals and only half of the animal with the anastomosis, and serosal vascularization was also present. We also looked microscopically at degrees of inflammation, looking at, for example, macrophages, and the presence of necrosis, fibrosis, and other things like reactive serosal fibrosis, and we have a higher score present in the ileotomy inflammation versus the compression anastomosis with the magnets. If you look at the histology, the presence between the rectum and the ileum, we see a nice continuity of the healing of the mucosa between the ileum and the rectum, and the mucosa and the serosa as well. So to summarize, at 7 days, the magnets are touching. We have 100% patent, nice, smooth anastomosis, which range from 28 millimeter to 38 millimeter in diameter. The pair of magnets move between 10 and 17 days, which is from the anastomotic site at a mean of 14 days. And there's more histological damages with the sutures compared to magnet compression anastomosis. Although this is a small number of animals, we've not seen any leaks, bleeding, or deaths. So I have to conclude that the anastomosis using linear magnets to achieve a side-to-side ileo-rectal anastomosis in pigs appear feasible and safe. And of course, more animal studies are needed to look at other colon locations that may have different thickness and muscular wall. Thank you very much.